So this is going to be the inferior drawer test, also known as Fagan's test. It tests the anterior-inferior portion of the glenohumeral capsule. Positives for this are going to be apprehension and excessive gliding of the humeral head in the glenoid. Positioning for this, she's going to be seated with shoulder abducted to 90 degrees and elbow fully extended. There's not really any stabilization other than me supporting her distal arm with my shoulder. Stress point is going to be at the proximal humerus, as close to the joint line as I can be. Movement is going to be an inferior and slightly anterior glide, and any kind of compensation I'm going to look for is any type of leaning of the torso. So we'll do uninvolved side first, extended 90, find the joint line, inferior, good. Alright, so this is going to be the posterior apprehension test. There aren't any other alternate names for it, and it tests the posterior capsule and posterior labrum. So positive findings for this are going to be any pain posteriorly, apprehension, or muscle guarding posteriorly. So position for this, she's going to be supine on the table with the tested shoulder off of the table. I'm going to stabilize the posterior shoulder of the one that I'm testing, and I'm going to apply the force at the olecranon and distal humerus, and my movement force is going to be directly posterior. Any compensations I'm looking for are going to be like any shoulder hiking or other apprehension. So this one, shoulders off the table, I'm going to come stabilize posteriorly, relax, and then my force is going to be directly posterior. And she's going to go to the affected side, maybe. Relax. Good. This next test is the crank test. There aren't any alternate names for it. And the structures it tests is the labrum. Positive findings for this are going to be pain, especially with external rotation portion of the movement and any clicking or catching. So for this, she's going to be supine with her shoulder abducted to like 90 and then slightly adducted. Stabilization is going to be the superior superior shoulder of the same side I'm testing. Stress point is going to be the olecranon process or distal humerus. And the movement is going to be internal and external rotation of the shoulder while applying an axial load. So any for this compensation I'm going to be looking for is any type of shoulder hiking or apprehension. So we'll go ahead and do uninvolved side first. So she's going to be abducted first off, slight adduction. I'm going to stabilize here, provide an axial load, and internally and externally rotate. Go to this side, same thing, here, stabilize, axial load, externally rotate. So this next one is the SPEEDS test, also known as biceps test or straight arms test. It tests biceps brachii and the long head of the biceps tendon. Positive findings for this is going to be pain along the tendon and weakness. So positioning for this can be done seated with the arm off the table or standing. Stabilization is going to be superior shoulder with me palpating right along that bicipital groove. Stress point is going to be the distal forearm, and I'm going to resist shoulder flexion. Any compensations for this is going to be any hiking of the shoulder or any elbow flexion throughout the movement. So I'm going to stabilize here, and then we want to start in slight extension, and I'm just going to go ahead and flex forward to 90. Good. All right, so any compensations would have been her starting to flex. So we're going to do that affected side. Stabilize here. Go ahead. Next one is the infraspinatus strength test. There aren't any alternate names. It's going to test the infraspinatus. Positive findings are going to be inability to resist force provided, or pain or weakness. So positioning, she's going to be seated on the table with elbow flexed to 90 degrees. I'm going to stabilize around the distal humerus. Stress point's going to be a distal forearm, and the movement she's going to do is going to be external rotation. So any compensations for this is going to be any shifting of the trunk or abducting of the shoulder. So we'll do on the right side first. So I'll go ahead and stabilize right here. Go ahead and push out. Good. Stabilize right here. Good. So the finals test is going to be Allen's test. There are not any alternate names for that, and the structures it tests is the subclavian artery and a little bit of pec minus for like tightness. Positive findings are going to be diminished pulse or diminished distal pulse or any numbness throughout the upper extremity. So positioning for this can be seated. I'm going to stabilize opposite shoulder. Stress point, there's not really a stress point, but I'm going to be doing the distal radial pulse. And then so for movement of this, I'm going to have her move into shoulder abduction of 90 and external rotation with the elbow flexed, and then have her look away. And so any compensations for this would be kind of adducting the shoulder back towards midline, or rotating the head back to a neutral position or towards me. So we'll do this side first. So go ahead and bring up. Good. Look away. Then I would wait for 10 to 30 seconds. So go ahead and do the other side. And bring your arm up, back a little bit. Try and externally rotate. Good. Away. Good. I would do that for 10 to 30 seconds as well.